Well, thank you so much for having me here today. I'm really honored to be here and to speak with you because this is something near and dear to my heart. And I thought that maybe, we could just discuss a few things. I broke down, some are specifically about Parkinson's, but sometimes, oh, and by the way, I'm with Visiting Angels. We provide non-medical care at home for folks. So, and I'm going to get into that, but basically, there are different levels of care. And I got into this industry a little over a decade ago, and I didn't know anything about the different levels of care. So I thought I'd break that down a little bit for you, because sometimes that's the most confusing part about navigating your health journey, And I'm here today, when I say near and dear to my heart, it's because I would love to help people be as independent as they can be at home, and also have a quality of life. And sometimes when you get at-home care, it makes you more independent. You don't have to rely on friends or neighbors or, and you can feel safe in your home. So that's really our mission at Visiting Angels, is to provide that quality of life and care. And the different levels of care would be, we'll start with non-medical care at home, which is mostly referred to as private duty care. And that's what Visiting Angels does. And we provide help with your daily activities of living. So it can be anything from, helping fall safety or meal prep, going on a walk, running errands, light housekeeping, laundry, things like that, it'd just be nice to have somebody come in and help with that occasionally. And private duty care can be anything from respite, so very temporary, to 24/7 long-term. I mean, it just depends. But we're not covered by insurance. Now, there's another type. So now here's another level of care. This might be if you went to the hospital or a rehab, maybe you had a procedure or something you had to have done, and you're gonna need some help, medical help at home. So this would be like Medicare home health care, or home health care is medical. And so, they provide like physical therapy, occupational therapy. They can help manage medications, which is very important, of course, with Parkinson's especially, because those medications have to be on time or it makes a big difference. And we will give, so a home health that's medical can actually administer medications. Private duty, non-medical, like Visiting Angels, we can give reminders. We could help open a bottle, but we cannot administer the medication. But we're still there to give the reminders, and that sometimes is very important because we get busy and we forget things. And then, so we've got private duty, we've got medical home health, and then we have skilled nursing, which would be, that's going to require nurses, doctors. It's just a higher level of medical care that's provided by people who are health professionals, like nurses. And hospice care, of course, too, which is more about just keeping people comfortable and helping them have some type of quality of life at the end of life. So those are the 4 levels. And now keep in mind, I'm going to open it up for questions and answers at the end. But each of these plays a very important role, in helping the people in our community and providing that quality of life. So another question that comes up a lot is, what is the difference between a home health aide and a CNA? So a home health aide, they are, they provide things like I talked about, Visiting Angels, dressing, bathing, those daily activities of living. And a certified nursing assistant, a CNA, they usually have done extra training medically. They've worked with medical professionals, nurses, doctors to assist them. And at Visiting Angels, we have both on our registry. We have both, home health aides and CNAs. And it's really more about with us matching the right caregiver to the right client, the right, and they do a real good job of that. We've got over 100 on our registry, and you get a free assessment if you're thinking about this. We'll have someone come and go over things that you're thinking about that you might need. And then based on that, we can vet out, like let's say you have a dog. We're not going to match you with somebody who doesn't like dogs, right? So those are very important things. Yeah, okay. So now specifically for Parkinson's companion care, there's a lot of points that are important, but social engagement, companionship, sometimes isolation, and that happens whether you have Parkinson's or not. As we age, sometimes it gets challenging to find those social engagements and have that stimulation of companionship that helps our mental health. So that's a real important thing with private duty especially. Also, getting up and out, exercise and encouragement. Sometimes it's hard to get up and out, or sometimes folks don't feel safe getting up and going out. They feel a little weary of that, or leery, I should say. I don't know if that's exactly what I want to do right now because I don't want to fall, or I don't feel safe. So, but when you can get up and out and you've got that companionship, that's a beautiful thing, and it does a world of difference, I think, mostly in our mental health. And then, as I touched on before, the medication reminders that are so important. And so you'd have somebody there to prompt you if needed. Also, nutrition, meals, meal prep. That's very important. I know with Parkinson's, it can get difficult chewing, swallowing sometimes. You might need a soft diet on certain days or all the time. And you need somebody there to help give you the soft diet, but also the nutrition that your body needs. So that's another very important thing. So just the companionship, the exercise, the movement, the nutrition, the medication reminders, those are really important. Lastly would be like if you needed help at night with sleep, maybe you've got some wandering going on or restlessness, or you need help with safety because you have to get up to use the restroom, something like that. That's something that private duty could also do. And at Visiting Angels, we do everything from an hour a week to 24/7. And I work with a lot of medical home health people, so we can provide referrals to each other, because sometimes medical home health comes in and they do their medical thing and then they go, but you might need a gap filled in between those for other things like errands or meal prep, something like that. But the sleeping is important too, because our caregivers can be there overnight if needed. And sometimes a caregiver needs a break. We can come in and provide respite care, or we can be there at night, even when, let's say, a spouse. I just went out and met these people, beautiful couple, but she just needed some help at night because he was getting up and just he was just feeling restless, and it was really kind of disrupting her sleep habits and everything. And so she had us come at night mostly. She didn't really need us during the day, but she really wanted our help at night. So with private duty home care, that's something that you have an option to request. You can really request just about anything. We probably have a caregiver on the registry who can provide it. And so why this all matters is we want all of our people in our community, but especially our seniors, to feel supported, to feel safe, and to feel as independent as they can with a good quality of life at home. And that's really why I'm here today, and that's why I do what I do. So with that being said, I want to thank you again for allowing me to be here, and I hope I answered your questions. And I am here, so if you'd like to ask, I'll open it up to any questions that you might have. And if not, now make sure you get a goodie bag. I put some really great helpful literature in there. And also there's like a jar opener. It gave a little gift. I love it. I use it all the time. Yeah. Yeah. And then a little brochure and a card, but you always need a tote bag, I figured. So, well, thank you so much. That concludes my talk. I hope it was helpful. Oh, that's a good question. So our rate at Visiting Angels, if it's 3 hours or under, it's 68 an hour. If it's over 3 hours, so 4 hours or more, it goes down to 38. Now, and on longer term assignments, let's say that we don't, this is going to be ongoing, there's room for negotiation at times. So, but that's our going rate. And that's very reasonable. That's about what everybody's charging. So, yes. I think always. Call the number on the back. Because it's not it's the office. And we cover, this is just for Visiting Angel's sake, but we cover Manatee, Sarasota, and a good portion of Charlotte counties too. And Josephine Carr she's the owner and operator. She's been doing this for over 15 years, and she's got a wonderful reputation. I was so happy to get to work for her. She's great. So, yes. Yes, that's what I was saying. So like home health, Medicare, home health, that would be covered by Medicare, but that's typically a short term because Medicare doesn't cover like long term. They cover. Yes, Medicare would cover for a certain amount of time them to have whatever, if they needed PT or OT or some other medical service, wound care, they would cover that, but then you would have to find a different way to pay after the short term. And I don't know the number of days, and I think it varies. Yeah. Yes. So at Visiting Angels, our rates, if it's 3 hours or under, so 1, 2, or 3 hours a shift. So you have a caregiver come out and he or she is there for 2 or 3 hours, it's 68 an hour. If they're there 4 hours or more, it drops to 38. Yep. No, not usually, but it can be, the rate can go down if it's a longer term. But I would want you to talk to either Jerry Marie or Josephine at the office about that because I don't do negotiations. I do assessments sometimes, but I just stick with the rate they give. But I do know that they have helped folks that, need longer term caregivers to be, So, yeah. All right. Again, I'd want you to talk to Josephine about that. I think that we do, but I don't want to say for certain because I don't know if we only work with certain ones, or but I think that is an option. Yeah. So, all right. Well, thanks again, everybody. I hope you enjoy the rest of your day. It's been lovely. I hope you had a good lunch. Yeah. All right. Very good. Okay. Thank you. You're welcome. Thank you.